So my project was focused on developing accessibility policy in nonprofit organizations. I completed my placement at Hearth Place Cancer Support Center. It's a nonprofit organization in Oshawa, Ontario. And they provide a variety of different programs and services to cancer patients and their family members completely free of charge, which is awesome. And they run entirely on community and private donations. And my project involved analyzing their existing policy manual and then identifying gaps, creating policy to fill those gaps with a focus on accessibility policy. So before jumping into what I did, just to touch on disability as a social determinant of health, people with disabilities make up the world's largest and most disadvantaged minority. Disability often intersects with income to further impact health. 40% of Canadians with disabilities are not in the workforce, and 44.1% of Ontarians with disabilities earn less than $20,000 annually, which is far below the living wage. And ableism is the idea that policies and practices, belief systems give preference to abled individuals. It's closely related to the medical model of disability, where it's assumed that the disability means poor health, when in fact it's actually the health inequity that causes poor health. And it's also related to the idea that ability is normal and disability is not normal, or that disabled individuals are exceptional for achieving something that an abled individual is able to achieve. A little bit of background on the legislation in Ontario that dictates accessibility policy. There's the Human Rights Code of Ontario. It prohibits discrimination on a protected ground, such as disability, in a protected social situation, such as employment. The Ontarians with Disabilities Act was enacted in 2001. It was intended to improve a variety of different social situations for people with disabilities by removing and preventing barriers, but it wasn't all that successful in translating into practice because there were no penalties, there were no deadlines, and organizational action was considered voluntary. So there was nothing saying that, hey, you actually have to comply with this, which led to the creation of the Accessibility for Ontarians with Disabilities Act, or the AODA, which now does say, hey, you actually do have to create accessible environments for people with disabilities. The AODA is the primary piece of legislation that influences accessibility policy, so we'll go into that with a little bit more detail. It was enacted in 2005 with the goal of making Ontario fully accessible by 2025, so we're at the halfway point. And it's the law that says organizations in Ontario must comply with the IASR, or the Integrated Accessibility Standards Regulation. And the IASR gives a variety of different standards in 5 areas of daily life listed there, and it specifically says what each organization must achieve to be considered in compliance with the AODA. And in addition to those 5 areas of daily life, it also says that organizations have to have accessibility policy, some organizations have to have a multi-year accessibility plan, and organizations in Ontario must provide accessibility training to all of their employees. So that's just a little bit more detail. So for my project, before I created any accessibility policy for my organization, they didn't have any in place as of yet, so it was kind of starting from scratch. I began by reviewing all of the IASR sections and tabulating the ones that were applicable to my small nonprofit. The IASR defines a small nonprofit as an organization with 1 to 49 employees, and if you have 20 employees or less, you're even lower. So you have even fewer regulations to follow. There's a total of 80 sections. Not all of them apply to nonprofits. And I retrieved documents published by the Ministry of Community and Social Services, and then the Ministry of Economic Development, Employment, and Infrastructure. I followed that with a literature search. I used a keyword searching method. Some of the keywords included disability, accessibility, policy, nonprofit, and it's important to note that there's a big disconnect between disability and accessibility in the literature. I had to substitute each word in almost every search because there's not a lot if you type in accessibility, but as soon as you go to disability, there's quite a bit more literature. Those were all of my eligibility criteria. Limitations were peer-reviewed journals and published in English. I didn't apply many limitations just because of the specific focus of the literature search. And findings from the governmental resource publications actually presented more issues than not issues. And this is what I found. After reviewing the IASR sections that applied to small nonprofits, they're not required to have written accessibility policy. They're not required to submit a record of training. If the organization has less than 20 employees, they don't need to file an accessibility compliance report, and there's little to no guidance from the provincial government for these organizations to actually develop accessibility policy. So they really fly under the radar. If the government was to come in and audit the organization, literally saying, hey, yep, we have a policy, but we don't have to write it, is considered good enough, which poses quite a few problems. Findings from my literature search, a total of 120 articles were retrieved, 18 met the inclusion criteria, and there were two main findings that I gathered from all of the literature that made the cut. The AOTA and the IASR regulations don't significantly contribute to the development of healthy, equitable accessibility policy for nonprofit organizations. And then I identified 7 characteristics of strong accessibility policy specifically focused to the nonprofit sector. So these are the 7 characteristics, and it's important to note that these characteristics are not limited to nonprofit organizations, but they are focused towards them. And admittedly, when I was going through them, they felt very common sense to me, but I had to kind of remember that it's common sense to somebody with a policy development background. Most of the time in nonprofit organizations, those creating accessibility policy don't have a policy background, so that common sense factor needs to be removed, and those were the 7 that I found. So for other nonprofit organizations, we have to recognize that they have a unique role in the health sector. Earlier, Catherine gave 150,000 nonprofit organizations. If you include the non-registered charities, it actually goes up to 170,000, which is huge. It's the second largest nonprofit sector in the entire world. So we need to pay more attention as to how policy is developed in the nonprofit sector because it merges into all of the other different sectors. And most nonprofits pick up, as Catherine mentioned earlier, which I was like, yes, pick up the work that governments slack on, right? So a lot of programs that are delivered by the nonprofit sector are public health programs, but in a not traditional public health setting. And it's important to note that usually smaller nonprofits have a better understanding of what their community needs. I've put here the local health integration networks, which is the Ontario equivalent of a health authority. But it's important to recognize that that role actually falls within public health. A lot of nonprofits don't view themselves as public health, including my organization. Public health was kind of new to them, but it worked out. So when I went to create policy, my plan was I'll start and I'll finish. The reality was not quite that simple. And that really stemmed from the idea that, okay, the AOTA has been in effect for 10 years. There should be a ton of great resources for me to build policy on, and there weren't. They actually caused more problems. So I think one of the main challenges was in a nonprofit sector or organization, time and money are very limited commodities. So they may forego what the evidence suggests as opposed to what the legislation requires, which can lead to variations across sectors, right? So a broader public sector organization is required to follow many more regulations than a nonprofit. And even though those regulations benefit a strong policy, those may be kind of swept under the rug because they're not legislatively required. And then implications for policy and practice. Implications for policy, creating consistent policy across all sectors would be great, not likely going to happen. That would require amendment to the AOTA, which likely won't happen until after 2025, so the government can say they met their goal. But you don't have to amend the AOTA in order to create healthy public policy. It does take evidence-informed policy, which is not a familiar area in most smaller nonprofits, but accessibility policy should facilitate community connection. And then with public health practice, the last point that I have there, I think applies to all sectors, nothing about me without me. And one of the main things that I found was connecting with community organizations and other people who are able to take on that advocacy role. Really, they strengthen the policy and the policy-making procedures for accessibility policy. And I'd like to acknowledge my two practicum supervisors, Andrea Shaw and Susan Vimnitz, for their leadership and guidance, and then everybody, Kathy, Victoria from University of Victoria. Thanks.
Thank you so much, Kirsten. Questions, comments? Yes.
Thank you, that was great. I'm just wondering, were there any resources put in place by the government for organizations to make their organizations more accessible? I can just see it being a real challenge, especially in small organizations, to do some of those things. So was that part of sort of a bigger scope plan for actually making this happen, right?
So there are resources for private and broader public sector organizations to develop those policies and to develop training modules. A nonprofit could use those resources, but it's not directed to what they need or to their unique role in the entire broader public health sector. I don't know if they're going to increase the number of resources that they have specifically for nonprofits. Ideally, they would. Nothing new has been released in the past couple of years. I think the most recent resource was 2010. But I imagine once 2025 hits and we're supposed to be accessible, more resources will be available.
Okay, other comments, questions? I see Victoria. Dr. Hayes, yes.
Thank you for an excellent presentation. I mean, it seems to me that you could build yourself a career in this sector, being a consultant to nonprofit groups to think through the ways in which these policies could be adapted to their scale and settings. And because I think you've clearly outlined here in a very impressive way the shortcomings of the big picture capital P policy landscape, particularly in the face of very small scale community organizations of the kind that Catherine spoke about this morning. So, I mean, I think if, you could just carve a career for yourself in this as a consultant to the sector and do lots of people a very good service to help to achieve the goals and the aspirational values that are contained in the legislation.
And I think the biggest aspect is once the organization wants to become accessible and go beyond what's required to actually really hit at those core values, there was a little bit of hesitation and resistance initially because it's the world of the unknown. A nonprofit is saying, hey, okay, I have to comply with the law, but the law doesn't tell me what I have to do. So that was the other thing that I found. Yeah.
Anybody else? No, we're good? Okay, thank you so much.